Hello, I'm Dr. George Best. I am a doctor of chiropractic and I practice in San Antonio, Texas. I've been in practice since 1992. This video is an introduction to some basic exercises for treating plantar fasciitis. So the first thing I'm going to do is explain what exactly plantar fasciitis is and the basic causes that produce it. So let's go ahead and start with that.
Plantar fasciitis is a degenerative condition of the plantar fascia, which is a tough ligamentous-like tissue that runs across the bottom of the foot. It interacts with the foot muscles as well as helps support the arches, and it also provides kind of a spring-like effect, so it's actually involved in propulsion when you're walking or running. And although it's the itis ending would suggest that it's an inflammatory condition, recent research has indicated that there's really not that much inflammation going on in most cases of plantar fasciitis. It is actually a degeneration where the tissue begins to break down, it gets little tears in it, it gets basically overworked, overused, and overstretched. There are probably several causes for the development of plantar fasciitis, but what's seen very commonly is a tightness in the Achilles tendon and in the calf muscles. And what happens is that the tightness in the calf and the Achilles pulls the heel bone upward and backward so that it places extra tension on the plantar fascia. And it is thought that this is what starts the problems in most cases. Now, the cause of tight calf muscles and tight Achilles tendon can come down to a couple of things. Plantar fasciitis is so commonly seen among distance runners that it's also called runner's heel in many cases. And things like long distance running definitely put a lot of tension on the calf, tend to make it really strong, but it also tends to tighten it up if people aren't stretching it out properly, especially after doing long distance runs. Likewise, somebody who's doing heavy weightlifting exercises for the calf and they're only creating muscle strength and muscle tension and not stretching the muscle out afterwards are going to be at risk for this type of problem. But it's not just people who are exercising that are at risk for plantar fasciitis. People who are sedentary also run the risk of developing this condition, and that's largely because when you don't move around much, the muscles tighten up. And somebody who's been sedentary who suddenly becomes active is going to be especially likely to develop it because their muscles are already a little bit tight. They tend to react a little bit more strongly to heavy exercise than somebody who's conditioned for it. And so it's very common for somebody who suddenly starts doing running or playing basketball or doing some other type of strenuous activity involving the feet that they would develop plantar fasciitis afterwards. Now, the other factor that comes into play is footwear. And the classic bad footwear for developing plantar fasciitis is high heels. This is because, number one, the shoes don't have any arch support at all in them usually. And the second factor is the heel itself. As we said, one of the problems is that the Achilles tendon gets tight and the calf muscles are tight and it pulls the heel up and back. Well, as you can see by looking at somebody in high heels, the heel itself, the shoe itself, actually puts the foot into that position and it tends to lead to tight calf muscles. So they may look great, but they're terrible for your feet and are a likely cause of developing plantar fasciitis, especially if you walk a long way in heels, if you have to be on your feet a lot wearing those types of shoes. But it's not just the stylish shoes that do it. Any shoe that has poor arch support can put you at risk for developing plantar fasciitis. And things like flip-flops, sandals, Keds sneakers, anything that's just got a flat footbed in it are going to put your arch in a compromised position and tend to lead to developing plantar fasciitis. Now, some people think that well, what about being barefoot? Well, the interesting thing about being barefoot is that you actually stimulate the nerve endings in the foot a little bit differently than you do when your feet are enclosed in shoes. And you actually stimulate the muscles of the arch to contract and stay strong and help support things in the foot. So people who go barefoot on a regular basis generally don't have as many problems with plantar fasciitis as somebody who wears bad shoes. So those are things to keep in mind as far as things to avoid for keeping your feet healthy and avoiding developing plantar fasciitis.
Now that you have a basic idea of what plantar fasciitis is and the types of things that cause it, I'm going to go into some basic exercises you can use to begin treating it yourself. Now, before I go into what the exercises are, I want to give you a very important tip. As I said, one of the big factors that contributes to the development of plantar fasciitis is tightness in the Achilles tendons and in turn the tightness in the calf muscles. And so you'll see a lot of people, including what I'm about to show you, recommending that you stretch the calf muscles. And so what you're about to see may be nothing new to you in terms of what I show you, but what is going to be a little different is the recommendation I have for how you do it, or how frequently you do it. A lot of times people will see an exercise either on a video, or they may even get the exercise prescribed to them by a physical therapist or a doctor, and they don't really get the point that, for stretching anyway, frequency will make a big difference in the types of results you get. And what I mean by that is typically what happens is you get the exercise and you do it for 5-10 minutes, once or twice a day, and that's it. And while that works pretty well in some cases, for a lot of people that's just simply not enough. If your muscles are really tight, you need to do a frequent stretch on them to get them to loosen up. And you don't need to do it for very long, you just need to do it often. And what I mean by often is, maybe 30 seconds or a minute, a few times every hour you're awake, at least initially, to start getting the muscle loosened up. Because you're trying to get that tissue to gradually lengthen. And it's going to work a lot better if you retrain it frequently than trying to do it all at once, just once or twice a day. So anyway, let's go ahead and go into the stretches. And remember, frequency is going to be your friend. So to stretch the calves and the Achilles tendons in the standing position, you're going to do it up against the wall or something heavy you can lean against to hold on to your balance. You want to point both of your feet directly at the wall. Position the back leg, which is the leg you're going to stretch, about 1.5 feet behind the front leg. And then you're just going to lean into the wall, keeping your back leg straight and the heel planted on the floor as the front leg bends and you lean towards the wall. You're going to hold that position for about 15 seconds. And then it's a good idea to actually switch legs, because even if you're only having symptoms on one side, it's a good idea to stretch both muscles. So you're going to repeat stretching the left leg. And you can go back and forth a few times. That is the standing calf stretch. I'll show you from a little different angle just so you can see how it's done from a little different view. So get your feet positioned, lean in. Again, the back leg stays straight and the heel stays flat on the floor. After you've done that side, you're going to switch off. You're going to make sure your feet are pointing directly perpendicular to the wall. So there you have it, that's the standing calf stretch. Now to do the towel stretch for the calf, you're going to take a long bath towel and you want it rolled up lengthwise, and you just kind of loop it over the foot, and you're going to just slowly pull back. Nice, slow, steady pull as far as the foot will go, and you're going to hold it for about 15 seconds. And then you can release slowly. You can kind of move it around a little bit, and again you're going to repeat, pull back firmly and slowly. release. And when you release, you can just kind of shake it out a little bit. You want to repeat that frequently throughout the day if you can to get the best results. So about maybe 3 or 4 repetitions, do it 2 or 3 times an hour. That's going to be ideal. If you can't do it that frequently, do it as frequently as you can. If you find that the standing up stretch works better, that it's more convenient for you to get it done, then go ahead and do that one. But this gives you another option, and it may give you a little bit different stretch than the kind of lunge forward runners type stretch that I showed you earlier. So that pretty much covers it for the towel stretch, and thank you for watching. I hope you found it useful. Alright, so now that we've gone over the ways to stretch your calf muscles, you may be wondering, what else can I do? Well, first of all, I wanted to tell you that over the years I've been in practice, and I've been in practice over 20 years, the vast majority of people actually get better just doing that stretch if they do it frequently enough. And most of them get better within a few days to a week or so if they do it frequently enough. So you don't need to get fancy with plantar fasciitis most of the time. But if you're one of those people that has a more resistant case, you may need to employ some additional methods.
So for additional resources to help you recover from plantar fasciitis, I invite you to visit my website at www.askdrbest.com, where you'll find additional information on what plantar fasciitis is and how you can treat it yourself. Thank you for watching.